This is going to be a talk about medical marijuana laws, and I really want to make it clear I'm talking about the laws just as much as about marijuana. And this is one of the things the pot lobby really tries to confuse, is they want to confuse medical marijuana use with medical marijuana laws. And they want to argue, well, all they want to argue about is whether marijuana has medical use. And the fact is, it does have medical use. By the way, so do cocaine, opium, and meth. Crystal meth is actually a prescription drug. I've never prescribed it, but it's there. The question is not whether marijuana is medical use, but whether medical marijuana laws are a good way to provide the benefit of cannabinoids. They also want to confuse CBD with marijuana. And so when I talk about marijuana and medical marijuana laws, I am referring to THC. CBD is the non-addictive component, and I'll mention that a little bit. Okay, so the criteria for approving a medicine in this country or medical delivery system is it has to have some medical benefit, it has to have no serious side effects, and if it does have side effects, then it better be significantly superior to anything else that you could use. And medical marijuana laws, and marijuana for that matter, really only meet criteria 1. And we don't approve medicines just because they're helpful for some people. Those are the 2 criteria are in there. So let me just briefly go over. There's things that marijuana is definitely good for, and there's good research behind it. So pain is probably number 1 these days. And the most studied is neuropathic pain, but that doesn't mean it's better for neuropathic pain than any other type of pain. It seems to be good for all types of pain. The other one is spasticity of multiple sclerosis. That's been really well studied. And the nausea and vomiting of chemotherapy. And that's one of the earliest studies. They're actually prescription cannabinoids. Marinol is approved for treating that. There's some smaller studies that I thought were pretty good. Appetite loss and wasting, both in cancer and HIV patients, and Crohn's disease. It seems to work. I didn't see anything ulcerative colitis, but it should be similar. Anyway, these are things that marijuana has definitely been shown to help with. But a couple caveats on this. One is, almost all these studies compared the cannabinoids to placebo, not to other medicine. And actually, for all of these things, all these medical conditions, there are non-addictive medicines that work as well. Marijuana is not the first choice for any condition. The third caveat is that most of the research was not done with marijuana. It was done with prescription cannabinoids. It was done with Marinol, which is synthetic THC. It was done with Seasomet, which is another synthetic THC. And both those are approved for use in this country. They're really expensive, which is the drug company's way of doing things. Sativex, which is not yet approved in this country, a combination of THC and CBD. In other countries, it's approved to treat the spasticity of multiple sclerosis. And a PDLX or Epidiolex, I don't know how it's pronounced, pure cannabidiol, pure CBD, approved for the use in childhood seizures. I think, the news reports keep saying marijuana has been shown to help. Actually, most of the studies were done with the prescription cannabinoids. And I'm going to say, I think we should be using these prescription medicines and not have medical marijuana laws. And I'm going to explain why here. And by the way, some of the studies, this is a huge study that came out recently. 1,500 pain patients on opioid pain medicine. Many of them also use marijuana. And what they found is that the marijuana users actually had more problems with pain and less ability to manage the pain. And they didn't find any evidence that marijuana reduced opioid use or opioid discontinuation. Now, this is like I said, long study. But it's the whole question, yes, it works for pain, but does it really, in real life, does it actually make a difference in people's experience of pain? And that hasn't been shown so well. Whereas the opioid pain medicines, which I don't like at all, chronic use of opioids are a terrible idea. But they clearly make a difference in how people function. Okay, there's one study that actually compared the prescription cannabinoid Marinol to marijuana. And what they found is both of them worked equally well for the pain. I think the pain was they had to put their hand in ice water and see how long they could tolerate it. They could tolerate it much longer when they were on Marinol or marijuana. But the Marinol worked twice as long as the marijuana, and people said they didn't get as high from the Marinol. So if you're a genuine pain patient, Marinol is actually preferable because you probably don't want the high, and you don't want to be having to dose every 3 or 4 hours. If you're a pothead, you like dosing every 3 or 4 hours. And that's, they use that term. I know people who are, I've got a patient who actually works at a medical marijuana farm, and he says they always, oh yeah, a lot of our workers medicate. Anyway, so again, there's really no reason to be using marijuana. The prescription cannabinoids work as well. Now, the things that there's some evidence for, but it's preliminary, Tourette's, HIV, hepatitis, Alzheimer's, it's good evidence, but it's just not a whole lot. Insomnia, I mean, it works for insomnia. I just hear this from people all the time. I don't like it. I don't like addictive drugs for insomnia. I'm always trying to get people off them. But anyway, I think there's evidence. It's not as good research evidence, but I think there's evidence that it helps with all these. With Alzheimer's, it works for the behavioral problems associated with it. But there's also other medicines that do that as well. Propranolol works really well for almost any patient who's got impulsive violence. Okay, things that there's no evidence for, or it actually makes the illness worse: glaucoma, epilepsy. Now this is THC, not CBD. Alcohol and other drug abuse, and any of the psychiatric illnesses. And I'm going to talk a little bit about PTSD. Glaucoma is the one that they sold marijuana for in the beginning. There's a lot of states that have passed a law. It's enshrined in state law that marijuana is good treatment for glaucoma. It's not. It decreases intraocular pressure. That's why they thought it'd be good, but it only works for 3 or 4 hours, and then there's a rebound. And it also decreases intraocular blood flow, which makes symptoms worse. So it's not recommended. The Glaucoma Foundation recommends against it. But like I said, it's now law in several states, which is why we really should not be approving laws by popular vote, approving medications by popular vote. PTSD, there's a lot of, the studies are all over the place. There's studies that show that it's absolutely wonderful, and there's studies that show no benefit at all. There's reviews of the studies that show that it's wonderful, and reviews that show it doesn't do anything. So politics is everywhere. The best review I found looked at 6 studies. 3 of them used Marinol, 3 of them used actual marijuana. Only 1 had a control group. All of them depended on self-report. And self-report is not very good when you're giving an addictive drug to a disease where there's a high percentage of people who are addicted. In PTSD, in some of the studies of PTSD, half of all the patients have a substance use problem. But anyway, they found there's some evidence for control of nightmares, insomnia, flashbacks, and night sweats. So it is helpful for some people. There's non-addictive medicines that work for all of those except for flashbacks. There's great medicines for the nightmares. And I just, don't like people's substance use problems being put on an addictive drug. I think it's, this inhibits, it causes more problems in the long run. One study that I found that I kind of liked, because it didn't just rely on self-report. It looked at their drug use, their violent behavior, their employment, looked at over 2,000 veterans, and it looked at the ones who smoked pot for years and years, the ones who never smoked pot, the ones who started smoking pot during treatment, and the ones who stopped smoking pot during treatment. And what it found is that the ones who never used or quit during treatment had the fewest PTSD symptoms. The long-term users, the ones who started during treatment, had the most symptoms, and they also had more drug and alcohol abuse. This is not too surprising. People use one drug are likely to want to use another, but they also found more violence in the ones who used marijuana, especially the ones who started during treatment. No difference in unemployment. So patients with PTSD often like addictive drugs. I really try to keep them away from it. But and I quote this study a lot. I just say, there's research showing it can make your PTSD symptoms worse. It's better to use non-addictive medicines. That's how it applies in my practice. I have a very firm belief that I've developed over the years that people are always happier off addictive drugs, especially people who have a substance abuse problem. They're always happier clean and sober. I do not think letting an addict continue to use is a favor. I have seen patients who quit marijuana and get totally clean and sober, and usually they're happier, and the symptoms they said marijuana was treating often get better. In fact, if it's a psychiatric symptom, it always seems to get better. So I try to get all my patients off addictive drugs. That includes the benzos, that includes opiate pain medicines. Exception is ADHD. I have just not found anything else that works for ADHD besides some of the stimulants. I do a lot of alternative medicine to treat anxiety. Anyway, using addictive drug daily is especially problematic. People take Ambien every night. I say, there's evidence that it's more prone to dementia. There was one study that showed people actually died younger. Chronic opioids do not work for chronic pain, except for very severe nerve pain. In my life, I've never started anyone on Xanax or Ambien. I think that's still true. And if they're using an addictive drug for sleep, I tell them you're never going to get better. You got to get on something non-addictive. Marijuana works for pain and it works for insomnia, but they're better off with a non-addictive medicine. This is what I tell my patients, and it makes psychiatric conditions worse. I really try to get all of my patients off marijuana, and I spend a lot of time talking to people about it. And it's kind of nice because I'm not the authority. They're getting it from somebody else. I'm just telling them. So I get to be the informant. I'm the repository of good information, and I try to be kind of neutral that way, even though I'm not. Well, for them I am. It really is their decision. Okay, criteria for approving a drug. As I said, has medical benefit? Yes, pot has medical benefit. Serious side effects? We'll look at that in a second. If there's side effects, then it's superior to the alternatives? No. The prescription cannabinoids like Marinol work as well or as better. So the question is, if other medicines work just as well, why do we even have medical marijuana laws? And the reason is, this was invented by NORML. It's a pro-legalization group. They were not interested in medicine. In fact, in '79, their founder actually admitted that he got quoted in some news article, and he denies it now, but he was quoted saying, we're going to use it as a red herring to give marijuana a good name. The idea did not come from physicians, healthcare providers, or advocacy groups. All of the ballot measures for medical marijuana were paid for largely by 3 billionaires. George Soros, who ideologically believes in legalization of all drugs, and then John Sperling, I forget his name. I forget the first name. Somebody Sperling from the University of Phoenix, and Peter Lewis from Progressive Insurance, who are both marijuana users. And that's why we have these laws. If it weren't for those 3 people, we wouldn't have anything. So side effects of marijuana itself, and this is from the National Academy of Medicine. Somebody asked earlier today about bipolar disorder, and their conclusion is there's a strong or moderate evidence that marijuana causes these things: motor vehicle accidents, overdoses by children, impaired learning, schizophrenia. It worsens bipolar disorder, doesn't cause it. Causes depression, causes suicide, causes social anxiety, causes or increases abuse of other drugs. And so if medical marijuana laws increase use, it's going to increase all of these problems. And I look at that as a side effect of the drug. And if it increases use, that's a side effect. So what are the side effects of medical marijuana laws? I think the biggest one is diversion to substance abuse, and that it increases both adult and teenage use. And I'll say lastly, it's a drain on state budget. So all these other things are, if it increases adult use, it's going to increase all the problems that marijuana causes.